Right, so this is a bedside teaching of a pigtail chest drain insertion. With me, I have our first year ED registrar. And this exercise, we're going to go through the indications and contraindications to putting in a chest drain, some of the steps and procedures and equipment that we need in order to successfully put a chest drain, and some of the complications. Unfortunately, we don't have consent from the patient because he's too drowsy. So what we'll do is I'll get you to go through all the equipment that we have in front of us, the steps that you're going to perform to put this chest drain in, any complications that you might expect and how to troubleshoot. From then on, we're actually going to put the chest drain in together. She's going to be the primary operator and I'm going to be the assistant, and I'll troubleshoot along the way. Unfortunately, once again, because we don't have consent from the patient, we won't be able to film that. Afterwards, we'll have a debrief session where we'll give some feedback and see how things go. All right, so do tell me, what are the indications for a chest drain, and what type of chest drains do you know?
So the indications for chest drain are any collection of fluid in the chest cavity that's not supposed to be there. So any pleural fluid, intrapleural fluid, like blood, serous fluid.
Yeah. Anything else?
Maybe air.
Anything else? Yeah, air.
Yeah.
So what you talk about is pneumothorax.
Pneumothorax.
Pneumothorax. That's correct. Yeah. And what are your experiences in terms of putting in chest drains?
I have seen chest drains being put in.
Yep.
I have not put in a chest drain myself.
Yep.
So this is a learning opportunity.
Wonderful. Yeah. So you once again you'll be the primary operator, and I'll be assisting you. Equipment-wise, what do we have here?
So equipment-wise, I've put all of my sharps and suturing equipment in here, including I've got some forceps, some scissors and suturing paraphernalia.
Yep.
I've got a chlorhexidine wand for cleaning the area, and I've got some drapes.
Yep.
I've got a fenestrate drape for the window. I'm not sure what this one is.
That's just a drape.
Just a drape. And then after I put the drape on to isolate the area that I will be using to insert the chest drain, I have a 5 ml syringe with some 1% lidocaine for local anesthetic.
Yep.
And after I put the lidocaine in, get the skin nice and numb, we will use the introducer needle, which is an 18 gauge needle, to enter the pleural space. And we have a syringe that will be attached to that to verify that we are indeed in the correct space and we have aspiration of fluid liquid.
Mm-hmm.
And then after we have confirmation of that, we will remove the syringe. I will put in the guide wire through the 18 gauge needle. Once the guide wire is in place, I will remove the needle while the guide wire is still under the skin and in the correct pleural space. We'll use a little bit of a scalpel to kind of open the skin up a little more and dilate it with this 14 gauge dilator.
Yep.
Remove the dilator over the guide wire and introduce the pigtail drain, which is here in white. It will have this stiffener inside to straighten out the edge of it since it is a pigtail drain. And then after the drain with the stiffener is introduced into the pleural cavity, we'll remove the stiffener and the drain will resume its pigtail shape. And then after that is firmly in place, we will close the drain while we attach it to the drainage container and then open the drain and allow it to drain.
Wonderful. Good.
And
Good. Perfect. Good. So that's usually the step we go through. A couple things for you to figure out. Do you know much about the triangle of safety?
Yes,
in terms of the position of putting in these drains?
Yes. So, triangle of safety, from what I understand, it does technically have strict borders, but I've only seen it done or visualized as a rough visualization of the area under the axilla. You count down to the 5th intercostal space at the axillary line,
Yep.
and that forms the inferior border,
Yep.
or triangle of 50.
Yep.
And the aim is to...
You know the anterior and posterior borders? Wonderful. Yeah, so triangle safety is very important because there are some significant structures that you go outside of the triangle that you might damage. So basically you have to position the patient in a sunbathing pose, I like to call it, with the arms up. The inferior borders, as you said, is the 5th intercostal space, also where the nipple line is. Anteriorly is the pec major, posteriorly is the left dorsal. If you go too far below, if you're on the right side, is what we're doing, you might hit what structure we might hit.
Diaphragm of the liver?
Yeah, the diaphragm liver. You definitely don't want to do that in someone who's diagnosed. Okay? And in terms of within the triangle safety, obviously there are multiple ribs. Where any specific sort of
Yeah, so,
target you want to go in terms of rib space? Or
so between the 2 ribs
Yeah,
that
between
you
two ribs.
pick,
Yeah.
you want to
go above
be
below?
superior to the inferior rib to avoid the vessel.
Yes. Yeah, so
Yeah.
the neurovascular bundle
The neurovascular bundle, yeah.
is inferior, right? Perfect. So we've set everything up already. We're going to go ahead. And now, one other tip. Could you pause that?
Yep.
Yep.
Wonderful. So, so we were talking about the triangle of safety. A couple of things of note. It's actually important to locate where you want to put the drain in before you put the drapes on. Because I've found that sometimes if you put them in the right position, put the drapes on, you obviously clean the area, put the drapes on, you
don't know
lose
where
all the
are.
landmarks, so it makes it very difficult. And I've seen people know where the triangle safety is, put the drape on, completely lose where they are because everything's covered, and get into trouble.
Right.
Okay? Other things to do before we start, it's good to load this with the stiffener. That will get you to do that. Yep, so this is all the way in. Perfect, good stuff. Are you happy to proceed?
Yes.
All right, good. So we'll go and put this chest drain in. She's going to be the first operator. I'll be guiding her with any issues, and then afterwards we'll do the